Namaste everyone. Myself Dr. Varuni. I am working as professor in Department of Faculty of Ancient Sciences, RPM Institute of Indigenous Sciences and Research, Bengaluru. So in the last class, we had studied regarding the Vata dosha, which is one among the three doshas, and some of the features like the qualities and the functions executed by Vata dosha. So in today's class, we will continue with the topic of Vata and its types. So Vata is classified into 5 types and they are called as Pranavayu, Udanavayu, Vyanavayu, Samanavayu and Apanavayu. So coming to the details, Prano atra murdhagaha, Uraha kanthacharo, Buddhi hridayendriya chittadhruk, Shthivana kshavatudgara, Nishwasanna praveshakrit. So here the Anvaya goes like this. Atra pranaha murdhagaha. Ura kanthacharaha. Buddhi hridayendriya chittadhruk. Shthivana kshavathu udgara. Nishwasa anna praveshakritcha. So they are giving the location or where it is situated, the pranavayu. It is present in murdhi or murdha pradesha, which means the frontal portion of the head. And there is a sanchara sthana or the place of movement or its field area where it does the work. So that sanchara sthana is called as uras and kantha. That means chest and throat region. Then it is executing some of the features like it is having control over the buddhi. Buddhi is the one which decides which is right and which is wrong when we do certain works. Hridaya being the heart. Indriya, various sense organs which executes the sensory functions related to the body, and chitta is the subtle stage where in our mind wherein our past experiences, the emotional impactful things get stored. So in addition to this, so in addition to this, some of the works require the supervision of pranavayu, such as the activities like spitting out, then sneezing. Shtivana is called as spitting. Kshavathu refers to the sneezing action. Udgara refers to the burp or the belchings. Then Nishwasa, the movement of air outside or exhalation, what we do. And Anna Praveshakrit. So here the food bolus is entering into the esophagus or the food pipe, and the process of swallowing is one among the chief functions of pranavayu. So as we said, so this is murdha, or the frontal portion of the head is the sthana for pranavayu, and its sanchara sthana is uras, refers to chest, and kantha refers to throat. Next, Udanavayu, Urhasthanam Udanasya, Nasa Nabhigalamschcharet, Vak Pravritti Prayatnorja Balavarna Smriti Kriyaha. Udanasya Urahasthanam. So the second type of Vata is called as Udana Vayu, and its location is Uras or the chest. And the Sanchara Sthana or the area or in which it moves or its field of work is between Nasa to Nabhi through the throat region. Nasa refers to the nose and Nabhi is the navel region. And via throat, this does various functions which will be executed in these regions of the body. And it is responsible for Vak Pravritti, that is speech. Prayatna refers to the instigation of the speech, and Urja refers to well-being. Bala and Varna here we can interpret as the Varnotpatti sthanas, which again is assisting in the Vak Pravritti, and Smriti, recalling capacity. So here Urasthanam Udanasya So Urus is the sthana, chest region is the sthana, and Sanchara is between Nasa to Nabhi. Nabhi is still down here in the navel region. So through the Kantha, it does the Sancharana, and it executes certain function as Vak Pravritti, the process of speech, which makes human or man being something special from all other animals because of the ability of speech. And Urja refers to well-being, and the Bala and Smriti. Smriti is the capacity to recall. So Varnotpatti sthanas we have studied in Sanskrita, that Akuha Visarjaniyanam Kantaha, Ichueshanam Talu, like this. So, for example, per varga can be explained only by the usage of the lips, or Dantavya, Talavya, like these, they are to be pronounced only with the help of certain parts of our mouth, nose, lips, etc. So, these are the organs which are included in the peripheral speech apparatus. There are two varieties. One is called a central speech apparatus, which involves brain, wherein when a person is asking our name, our brain thinks an answer for that. That means to say, so when a person named A is asking, what is your name? We understand it as a group of words in the form of hearing sensation only. Then there is another part in our brain which analyzes what is the meaning of these groups of words which has fallen onto our ears. So later, it is called as the vernix area, and that is helping in understanding that the opposite person is asking my name. So we have to introduce ourselves. So in this process, we begin to converse with them, telling that my name is XYZ. So in this way, when we are starting a conversation, before even the actual words come out from the mouth, there should be synthesis of speech or generation of the speech which is responsible or which is happening in our brain. So that process is again done by Udana Vayu. Vak Pravritti and the Prayatna both can be attributed to this. Urja, then Bala Varna, that is Varnotpatti. Here, Varnotpatti, when I'm speaking about this peripheral speech apparatus, the various structures involved are nose, throat, tongue, hard palate, soft palate, lips. All these are different parts of our mouth and nasal cavity. For example, Anunasikas can be pronounced only with the help of the nasal cavity. So, including this peripheral speech apparatus, we will be able to converse well. So, that is also one among the functions of Udana Vayu. Then, coming to the third variety, Vyana Vayu, Vyano Hridisthitaha, Kritsnadehachari Mahajavaha, गति अपक्षेपणोत्क्षेप निमेष उन्मेषणाधिकाः प्रायः सर्वाः क्रियास्तस्मिन् प्रतिबद्धाः शरीरिणाम्. So here we can understand that Vyano Hridisthitaha. So the location of Vyana Vayu is Hridaya, or though it is located in Hridaya, but its field of work or the area where it does the sanchara is all over the body. So Kritsna Dehachari Mahajavaha. So it is having a lot of strength and is capable of executing lot many activities. And it is mainly involved in controlling the functions like gati, the movement of the body, utkshepana and apakshepana, upward and downward movements happening, nimesha unmeshana, that is opening and closing of the eyes. Then all the activities of the body is being executed by this Vyana Vayu. The seat being the Hridaya, Sanchara Sthana is all over the body, and some of the functions which I just mentioned is executed by Vyana Vayu. Next, Samana Vayu. So Samana Vayu is present near Agni. Samano Agni Samipasthaha, Koshthe Charati Sarvataha. Annam grinhati pachati vivechayati munchati. So this Samana Vayu is present near the Agni. So when we say Agni, it is the digestive fire or the capacity to digest the food. So it is usually placed in between the stomach and the intestines. So we call it as Pakvamashaya Madhya, or in between the Amashaya and the Pakvashaya, which means to say stomach and intestine. So this Agni is capable of digesting the food. Samano Agni Samepasthaha. And where is its Sancharasthana? Koshthe charati sarvataha. So this type of vata will be traveling all over the koshtha. That is, it is going to move in total abdominal area, which includes most of the digestive organs. Koshthe charati sarvataha. What are its functions? Annam grinhati. It is going to receive the food. So amongst the digestive organs, which is going to receive the food? The stomach. It is called as a food bag. So this receives the food. Annam grinhati. What it does later? Digestion happens in the stomach and also in the small intestines. So the Annam grinhati pachati. Pachana refers to digestion. But next, vivechayati. Vivechana refers to the separation of nutrient portion and the less nutrient or the waste portion, which is not required for our body. So that is being separated. So vivechana and munchana. Munchana refers to further sending ahead of what the waste products which are being separated, that will be pushed ahead for next place for its excretion. So here pachati vivechayati munchati. So these are the functions done by samana vayu. Next we have apana vayu, the last type of vata. Apano apanagah shroni basti medroru gocharaha shukrartava shakranmutra garbha nishkramana kriyaha. So this apana vayu is present in apana pradesha, apanaha apanagaha. What is apana pradesha? It is basically the pelvic region. Then where is it sancharasthana, or where is it being traveling? Shroni basti medra uru. So these are the places. Shroni, that again in the pelvic region. Basti. So basti refers to the urinary bladder. Medra refers to the male genital organ. Uru refers to the thigh. So these are some of the places in which it does the sancharana. Then the functions executed by Apanavayu is that it is going to expel out Nishkramana Kriya. Nishkramana means to throw out of the body. What is being excreted? Shukra, Artava, Shakrit, Mutra, and Garbha. These are the 5 components which it is going to excrete. Shukra refers to the semen which will be discharged from the male genital organ. Artava refers to the menstrual fluid, which is menstrual blood, which comes out in the form of cyclical cyclical manner, that is menstrual cycle every month which is happening. Artava. Shakrit refers to the process of defecation. Mutra refers to urination. The kidney produces urine which is collected in the urinary bladder and is later sent out through urethra. Then Garbha. Garbha refers to during pregnancy and when the lady is approaching towards the labor or the time of delivery. At that time, through the birth canal, the baby will be coming out. So these are some of the works executed by Apanavayu. Next, we have Vata Vriddhi Lakshana. So let us understand what are the features or what are the clinical signs and symptoms, or what we experience whenever Vata increases in our body. Vruddhastu kurute anilaha karshya karshnya ushnakamatva kampanaha shakradgrahan bala nidrendriya bhramsha pralapa brahmadinataha. So here Vruddhastu kurute anilaha. Karshya. So the person becomes emaciated like this. Emaciation is one among the important features when we see whenever there is Vata Vriddhi. Karshya. Then Karshnya refers to blackish discoloration. As we can see here, there is blackish discoloration in different parts of the body. Ushna Kamatva, the basic quality of Vata is cold potency, having Shitata. So, whenever that Vata dosha increases in our body, always we will feel like having the opposite type. For example, we taking a common example, like for example, maybe if we are suffering from cough and cold. So at that time, we never feel like eating further more cold items like ice cream or juice. So we always feel like having a hot soup or a cup of coffee, something like this. So because already there is excessive Shita present in our body, we like to have the opposite qualities. So here also, because of the Shita Guna which the Vata is possessing, there will be liking towards hot substances and Ushna Kamatva. Then certain signs we can see. There will be tremors. Tremors refers to mild shivering or shaking of the hands and legs. Fine tremors will be there whenever there is increase in the vata. Kampa anaha. Anaha refers to bloating of the abdomen. Kampa anaha. Shakrit grahan. Shakrit refers to the hard stools. Stools which gets graha refers to it is not allowing for easy evacuation because vata has increased, there will be constipation seen. Bala Nidra Indriya Bhramsha and Pralapa. These are seen. So, what is Bala Bhramsha? The person will be losing strength or he feels weak. Nidra Bhramsha. So, there will be loss of sleep. So, even in the midnight, the girl is not able to sleep. In the Bala Nidra Bhramsha, Indriyas will not be able to perform its functions. Pralapa refers to talkativeness or blabbering continuously, irrelevant speech. So it is something which is over in or excessive in nature. Brahma refers to giddiness. So these are some of the features which are seen whenever Vata increases. Coming to Vata Kshaya Lakshana, लिंगम क्षीणे अनिले अंगस्य सादो अल्पम भाषिते हितम संज्ञा मोहस्तथा श्लेष्मा वृद्ध्युक्तामय संभवः. Let us look at the Anvaya Krama. Anile Kshine Lingam. What are the features seen whenever Vatakshaya happens? Angasya Sadaha. So there is debility or loss of strength or tiredness or weakness sensation in different organs of the body. Bhashite hitam alpam. If they feel better whenever they speak very less. Then samjna mohaha. There might be loss of consciousness or a sort of delirium. And because vata has got decreased, the opposite quality of the doshas, that is specifically kapha dosha possesses all the qualities opposite to that of vata. So kapha will definitely increase. So these are opposite in nature. If vata increases, kapha reduces. So if kapha increases, vata will decrease. So in this condition, here we are enlisting or enumerating the clinical features seen whenever vata is depleting. As a result, we see a set of diseases or conditions wherein kapha will be increased. So that is seen here. Angasada. So whole throughout the day, they always be feeling tiredness or lack of energy. Acharya Sharangara, who is one among the authors of Laghutrayi, that means not as big as Samhitas, what like we are exposed to, like Charaka Samhita, Sushruta Samhita, etc. These are lesser voluminous voluminous books which are written by our acharyas. So he has stated the importance of Vata amongst all the three doshas. Why only Vata is being considered so very important? The reason being, Pittam Pangu Kafam Pangu, Pangavo Maladhatavaha, Vayuna Yatra Niyante Tatra Gachanti Meghavat. So here, Pittam Pangu, Kafam Pangu, Maladhatavaha Pangavaha. So all these bodily components, like the other doshas, other two doshas like Pitta and Kapha, the malas, which are three in number, Purisha, Mutra and Sweda, and the dhatus, Sapta dhatus, starting from Rasa Rakta till Shukra, all these are considered as lame, means they do not have the capacity to move on their own. So as a result, it is only the vata which carries them to different parts of the body and is responsible for creating various other disorders. So here, Vayuna yatra niyante tatra gachanti meghavat. So just like wind is carrying away the clouds, wherever the wind blows or wherever the wind takes the cloud, there the cloud goes along with the wind. So wind does not have any independent movement. So wherever wind blows, sorry, cloud does not have any independent movement. So wherever wind blows, there the cloud goes along with it. So in the same way, all these entities of our body, they lack motion or gati. They are immobile in nature. Only vata is having the capacity to move. So it takes all these structures along with it. Next, we have Yogavaha guna of vata. So this is the quality, another special quality which vata possesses. So here Acharya is explaining Yogavahaha param vayuhu samyogadubhayarthakrit dahakrit tejasa yuktaha sheetakrit soma samshrayat. Let us look at the Anvaya Krama. Param Yogavahaha vayuhu samyogat ubhayarthakrit tejasa yuktaha dahakrit soma samshrayat cha sheetakrit. So now here Vata is exhibiting a dual nature. Double mode. So when it is associated with Agni or Tejas, it is going to cause burning sensation. Basically, Vata is having the quality of Shita and it doesn't cause any burning sensation. But because of its association or making friendship with Agni, it is acquiring one among the gunas of Agni, which is burning. So when it is associated with Agni, it causes Daha. And when it associated with the Saumya Dhatus or Saumya components, then it causes Shitata or it becomes further more cold. So this brings us to the end of the concept of Vata and its importance, types, qualities, functions, all these things we have known so far. Moving ahead to the next dosha, it is about Pitta. So where all in our body can we see the Pitta being situated? Nabhi Ramashayah Svedo Lasika Rudhiram Rasaha Driksparshanam cha Pittasya Nabhiratra Visheshataha. So here, these are some of the bodily parts which are enlisted. In all these places, we see presence of Pitta. So the Anvaya Krama goes like this. Pittasya Nabhihi Amashayaha Svedaha Lasika Druk Rudhiram Rasaha Sparshanam cha Atra Visheshataha Nabhihi. So here, these are some of the places where Pitta is majorly located. Nabhi. The Nabhi or the navel region is one among the Pradhana Sthana or the most important location amongst all. Amashaya refers to stomach. Sweda, in the sweat, the product, whenever we feel hot, there is sweat secretion. So in that also there is presence of Pitta. Lasika. Lasika is called as lymph secretions which are happening in our body. Rudhira, that is Rakta. In Rakta also there is presence of Pitta. Driksparshanam cha Pittasya. So here in Drik or the Akshi or the eyes, there is a location of the Pitta, and Skin as well. Skin refers to the sense organ here. Mm, there is in the skin also, that is one among the sites for location of pitta. Driksparshanam cha pittasya. Amongst all these sthana, this nabhi is considered as the pradhana sthana. Coming to the qualities of pitta, pittam sasneha tikshnoshnam, laghu visram saram dravam. So, some of the qualities what the pitta has are, it is being unctuous in nature, it is being snigdha or sneha guna is seen pradhanataya, and it is having the quality of ushna and tikshna. Tikshna is something which is sharp, it is quick in action, and visram saram dravam. So here it is light in nature, laghu, and visra, a sort of foul smell is observed, and it is having saraguna, and it is drava in nature, it is fluid in nature, and it is having the property to flow. Coming to the functions executed by pitta. Pittam paktyushma darshanaihi kshutrudruchi prabha medha dhishaurya tanumardavaihi. So the functions executed by pitta includes pakti. Pakti refers to pachana. Here, the main job of pitta is digestion. So, it is not just the food digestion. Anything which has to be assimilated into our body has to be made acceptable by our body. So, first, that is the step. So, this process of conversion of making certain things as becoming acceptable to our body, this process of transformation is brought in by pitta. Then, pushma. So, here it is the core body temperature, we can say that, which is responsible for the maintenance of our body. Then darshana, for vision to occur, for the visual process to happen, pitta is essential, and it creates the hunger sensation, thirst sensation. It brings in the liking towards the food. The intelligence what we have is governed by pitta, and the shaurya or the valor, the courage what we exhibit, all these are some of the qualities which pitta is exhibiting. Then coming to some of the types, there are 5 types again. Each dosha, vata, pitta, kapha, all these 3 doshas are classified into 5 types each. Coming to the first variety, pachaka pitta. So here, tatra pakvamashaya madhyagam पंचभूतात्मकत्वे अपि यत् तैजसगुणोदयात् त्यक्तद्रवत्वं पाकादिकर्मणा अनलशब्दितं पचत्यन्नं विभजते सारकिट्टौ पृथक् तथा तत्रस्थमेव पित्तानां शेषाणामप्यनुग्रहं करोति बलदानेन पाचकं नाम तत्स्मृतम्. So this much is the information given about Pachaka Pitta. So this Pachaka Pitta, it is one among the types of pitta, is located in between stomach and the intestines. So pakwa, pakwashaya and amashaya madhyaga. So it is located in between the stomach and large intestine, and though it is made up of all the 5 mahabhutas, so akasha, vayu, agni, up, and prithvi, these are the pancha mahabhutas. Though even this entity is made up of all these 5 mahabhutas, predominantly it is having the role of agni mahabhuta, or it is taking or imbibing the qualities of Agni Mahabhuta, and it is devoid of Dravatva. It is unlike, it is not having the fluid nature, but it is responsible for digestion or any transformation which is brought about in the body. Because of this process of getting things transformed, this is also called, or it is also helping in the process of digestion majorly. It is called as anala. Anala is the synonym for Agni. Pachati annam vibhajate sarakittau prithak tatha. Pachati annam. So what is its job? It is to digest the food. Annam pachati. After pachana or after digestion, what it does a separation of nutrient portion and waste portion. So that will be divided. Sara refers to nutrient portion, Kitta refers to waste portion. So that will be divided by Pachaka Pitta. And Tatrasthameva Pittanam Sheshanamapi Anugraham. So by being located in its own place, it is going to bestow or give strength to other types of Pitta. So hence it is called as Pachaka Pitta. So this much is the description about Pachaka Pitta. Next, second variety of Pitta is called as Ranjaka Pitta. In the name itself, we have the word Ranjana. Ranjana refers to imparting color. So where is this Pitta located? It is present in Amashaya or stomach. Amashaya Shrayam Pittam Ranjakam Rasaranjanat. So this Pitta, this type of Pitta is located in Amashaya or the stomach, and it does impart the color to the Rasa, the first dhatu, and hence it is responsible for the formation of the next dhatu, that is Rakta. The third variety of Pitta is Sadhaka Pitta. Buddhi Medha Abhimanadhyaihi Abhipretartha Sadhanat Sadhakam Hridgatam Pittam. So this Pitta is located in Hridaya, Hridgatam. So it is present in Hridaya. What it is responsible for? The buddhi, which is good, which is bad, this discriminating ability what we have is governed by Sadhaka Pitta. The intelligence, the self-esteem or the abhimana, by we have certain ego. It is not ego here doesn't mean in a wrong way or a negative way. We are proud about ourselves for being what we are. So this abhimana, and whatever we desire about, we will be able to achieve that goal. Whatever we aspire for, we have that potency to achieve. So that is again a quality attributed by Sadhaka Pitta. Then Alochaka Pitta. So this is another fourth type of Pitta. Rupalochanatah smritam drikstham alochakam. So this is located in Akshi or eyes, and this is responsible for the visual process to happen. So presence of Alochaka Pitta is very much helpful in for us in seeing various objects. Otherwise, vision would not have been possible without this. The last variety, Bhrajaka Pitta. So this is present in the skin, Twakstham, where it is present in the twak or the skin. Twakstham Bhrajakam Bhrajanat Twachaha. So it does gives luster to the skin. So that is the Bhrajana karma which is done by this particular Pitta. So these are the 5 varieties of Pitta. So in this class, I'll be concluding at this point, and from next class, we will take up further details and the remaining dosha, kapha. Thank you everyone for your patient listening. Dhanyavada.